have all these parts and pieces, so you guys want to know all this. So let's see if we can go through some of it.
So that's a simple mask, right?
This is not a simple mask.
Oh, Oxy mask, because it Venti mask, because it has the
It is a
holes.
Venti mask, but it is an air entrainment mask, you guys,
Air
right? So
entrainment.
these are both air entrainment masks
Because the holes on the side.
because it has an air entrainment port.
Oh, duh.
Okay.
So we can distinguish them by that if they have
Yep.
the air entrainment port.
If they have an air entrainment port, you are likely going to be an air entrainment mask, right? Now these two work differently. On this one, I changed the size of the air entrainment port, right? To control my FiO2. You guys can see as I go up, let's go to the right one. As I go up in FiO2, my air entrainment port gets
Smaller because you're
gets
pulling
smaller.
in less room.
As I go down in FiO2, my air entrainment port gets bigger, right? As opposed to this one, it uses the size of the orifice. So if you look in these things, the size of the orifice is different, but the air entrainment stays the same.
So this little tube is what you're saying?
Yes.
Don't control FiO2.
So we control FiO2, but you control it by the flow restriction that's created by the orifice size in the center.
That makes my
Because
notes
all
make so
of
much
these
more
are all the
sense.
same air entrainment size port, right? So you either control the size of the air entrainment port or the size of the flow restriction
Jet
going to it.
orifice. That makes my notes make so much more sense.
Yes, they usually will not carry both though. You will usually just have one air entrainment mask that you have at your facility.
Can I read it? Say it back to you so I make sure I understand.
Yep.
Okay, so on this one, we're actually controlling it through the air entrainment. And
the
then
size of the air entrainment
the
port.
bigger the hole of the air entrainment, the less the FiO2 is going to be. And
Correct.
when I lessen this, the air entrainment size, my FiO2 is going to go up because I'm bringing in less room air.
Good. Now what happens with your total flow as I decrease the FiO2 and the air entrainment?
I'm going to get a higher flow
You're going to get a higher
because
total
I'm
flow.
bringing in more room
Good.
air.
So when I increase the FiO2, it decreases the size, also decreases
The flow.
the total flow.
And then on this one, we are controlling the FiO2 based off the orifice. This whole piece is going to change out, and this size of
And
little
how
thing.
you guys would clue into that if you guys don't remember, if you guys did look
At
at the
the
end,
bottom, it tells us what
it
the
tells you what
FiO2
flow
is.
and what FiO2 you were given with that corresponding adapter.
Okay, so give
Okay.
me an example question of what.
I just did.
Oh, never mind.
When
Okay.
I decrease the FiO2, what happened to the air entrainment port? If you know all of that, you'll be fine with these.
Oh, okay. Cool.
Can I use a humidifier with these?
Wait, yeah, you can.
You can.
Always
We
can.
just don't.
Isn't
usually.
it over 4 liters though?
Yeah.
That you want us
You
to
can
use?
use it at any point, right? Over 4 liters mandated, or we are going to suggest it under 4 liters. If they suggest it, we give it to them.
If they ask for it.
Yep.
And then you said if they were elderly or had dry skin and all that
Yep.
stuff.
If we
is
have
included,
signs
right?
of humidity deficit, then we can do it then too. Yeah.
Okay.
Okay. What's this one?
That's a non-rebreather.
Good.
And then it has to stay at least 1/2 to 1/3 full.
Good. So how do I manipulate the flow? That would be your answer,
Oh,
right? How
And
do I
that
how do I know what flow to set on this? That would be my answer. Is
make sure
when the
back-
patient breathes.
the bag has to stay
The bag
1/2 to
has to
1/3
stay
full. And we
with
never
air in it,
use a
at least.
humidifier. on
Why?
this. Can it burn their face or stick to it or something?
Why don't we use a
Only a
humidifier?
one-way valve.
It's the one-way valve.
One-way valve.
It's paper, you guys, or a little bit of rubber, but it'll stick. If it gets moist, it'll stick.
Oh, that's
Okay, so the
sweet.
one-well valve will stick. So it's for emergencies only. Do we want to leave somebody on this long term?
No, that's for emergency situations.
Right. So it's a high concentration of oxygen, though. How much oxygen? Upwards of 75%. You guys, I think the range that was listed in the PowerPoint was like 75 to 100 or something, or 95% or something like that. It's high.
And no humidifier because it's a one-way valve.
No humidifier because it will stick the one-way valve. Good. What's this one?
Is that the Venti?
Nope. You guys did list this one when we were talking about it, though.
That's the oxygen.
Oxy mask, good. So this one, just so you guys know, there's a complete cheater style on it. It has a tag.
Oh,
okay?
thanks.
I'll probably tear that off for your test,
No.
but we'll see. But also, how much oxygen can this give?
1 to 6.
Liters per minute. It's going to give up to 15 liters per minute.
Oh.
Say it, Mariah.
15.
Oh, I'm thinking
1 to
of-
15 liters. What's the corresponding FiO2 though it gives you for that?
Large ranges.
It's a huge range,
I
you
was gonna
guys,
say.
right? So you can do 115 liters. It's going to tell you anywhere from 24, I think, to 95. 90 is what it says. 24 to 90 is
Oh,
what it
I was
says on
giving
here.
you the simple mask stuff.
Yeah. So 24 to 90 is what it'll tell you guys for FiO2. Just know this is wide range too. So do we use this all the time?
No.
Nope. But is it a good thing to have in an emergency? Heck yeah.
Is this the one that we use so that we can have better communication and better oral care and all
Yep,
that stuff
yep.
because the holes in it?
Yep, because
Okay.
it gives us better access to their face, right?
Okay.
But
And if they're
also
claustrophobic.
why the FiO2 will be completely variable, right? Is because of all these holes in the mask, you guys. Because if I can't concentrate it to a certain amount of flow, I'm not going to know. It's
Oh,
going to be
that's
all
why
based
the
on their
range is-
breathing,
okay.
right? So when it tells you guys things that increase or decrease your oxygenation, when we were talking about your anatomic reservoir,
Mm-hmm.
that's all going to come into play when you're on one of these, which is why the ranges on them are so huge.
Oh.
Okay. That's the same thing. Oh, what's this one? Regular nasal cannula. Good. What is it? What flows does it do?
1 through 6.
Good. And what's our FiO2? Because we're going to memorize
24
this
to 44.
one. We are. So 1 liter's what?
124, and then it goes up by 4.
It goes up by 4. Good. So 24, 28, 32, 36, 40, 44. Good. What is this called?
A baby.
A baby one. A baby aerosol mask is what we actually call this one. I realized that I didn't actually show you guys a lot about aerosol masks, but anytime you have a mask that isn't connected to something is generally what they'll call an aerosol mask. You guys will just find out that some aerosol masks are not transmitted or are not treated equally, right? So this is actually from the Venti mask. The Venti mask very much looks like a simple mask when you take it off, but it is not because it does not have the connector. Okay. Will this fit onto a simple mask? Probably, if I want to cram it on there, right? But it's not meant to go there, so we do not work those that way.
And
What I will
this
do,
is-
you guys, is this would be a small volume nebulizer would connect to this.
Can you put oxygen on those? Or
You
is it just
cannot
for
put oxygen
nebulizing?
on these ones. It would more likely be for nebulization or aerosol delivery, right? So
But
on
it's
our,
called a baby mask?
No.
it is not.
I was like, what?
It's called a aerosol mask.
aerosol.
But that's how your nebulizer would connect to it,
Okay.
right? So if I have any kind of corrugated tubing, you guys, it will connect to. Okay, so it's universal to the corrugated tubing. So that would be your aerosols or your large volume nebulizers or your small volume nebulizers.
And this.
So humidity and nebulization. Okay, they make them in big people size though too, but that's what they're called. Is an aerosol mask.
It's just the infant size, adult size.
Yeah, this is just a pediatric size for whatever reason. That's what I had in here. We'll go over that in a second. What do we call? I have it in here. Oh, it's right here. What do we call this thing?
Phase 10.
Good. And this would go on what?
Trach. Or your face, right?
It could go on your face. It usually doesn't go on your trach.
Okay, that's not.
That we have a trach mask that does that though. But it does also hook up to your large volume or small volume nebulizers, right? So if I had a patient who couldn't hold a nebulizer treatment and had surgery on their face, I could give them a small volume nebulizer treatment through this if I just take the nebulizer tubing and connect it to here.
Oh, so
Right?
if they have like a nasal surgery and you're trying not to put
Pressure on their
it?
face. Exactly. We have other devices. So any of these interfaces, you guys, are universally adaptable to all your corrugated tubing.
So still no oxygen on that. It's just for.
So you can give oxygen on this if you're doing the large volume aerosol. So that would be this type of top, right? It's still an air entrainment type of top,
Okay.
but we call it a large volume nebulizer or an aerosol device. Anytime you guys have those bigger bottles of water though with these tops on them, or the large bottle of water with a blue top that is just like this, that is what we call a large volume nebulizer or an aerosol top. You can give oxygen through these based on the tops.
Okay.
Okay. Small volume nebulizer you give medicine through. This you can give oxygen through. So technically then with your aerosol mask you could give, if it was hooked up to this, you could give oxygen as well. Okay, so
You typically do that?
when you're giving humidity. The only time you're going to use a large volume nebulizer is when you're giving humidity. Okay. These things. This is just for you guys to know what they are called.
Oh, it's
How we can control that, like,
it's the key.
Oxygen key. Good. Oh, I know this one.
Oh, is that the one attached to the portable?
and then
That's
Yep.
a Christmas tree.
Yeah, so this is what I use to open up the
Those
flow
are
restrictor.
normally already attached.
Flow
on here.
restrictor or a Christmas tree.
Oh.
She was right. And then this thing, you guys, is just the little washer that goes on with your pen tanks. But I kept it just so you guys know what you guys are looking for, right? So if you guys have to use a regulator, that's what you guys are on it. But oxygen
this
key,
one goes to 30,
Christmas
and then this
tree.
one goes to 70.
Or flow restrictor.
So as soon as you get above 30,
Okay.
you should be
There's the trach.
That's the trach piece.
trach mask or trach collar. universal adapter as well. Oh, I have lots of baby masks.
And that can be used for multiple things, right?
why
The
that's
trait
what
collar.
Yes, just
Okay.
like your
Right now.
It's
trait
whatever
collar,
you want
face
with
tint,
the
aerosol mask,
And then
T-piece can pretty much be used on whatever adaptation you can make it, right? As long as it's corrugated tubing,
yeah.
you guys have an adapter that it'll adapt to.
Okay.
This is just a simple mask.
Simple mask, good. How much?
Yeah,
What
this is
flows
cannula.
do we run this at?
24 to 44.
Liters per minute?
Mm-mm.
This one is 6 still.
6 is the minimum, so you go 6 to what?
Oh, 6 to 15?
6 to 10, good.
So you don't want to rebreathe the CO2.
Because you don't want to rebreathe the CO2, right? These little holes are not enough for
Which
your
one's that?
CO2
So
to exhale.
simple mask,
Simple
6
mask.
to 10.
6 to 10 liters, no less than 6 due to chances for patient to CO2 rebreathe,
Okay.
More than 10, that would be high flow.
right? More than 10, we just don't go above it because we don't get any more increases, I think,
right.
above the 55% or whatever they quote you guys, but that's what they quote you guys for your ranges is what?
55 to like
30,
35 or something.
35 to 55, right? And I don't want you guys to necessarily know 7 liters is 40%, right? You guys don't have to know that, but know your range on this one.
35 to 55 was that FiO2?
And it goes by 5s. How that
It
goes
used
by
to be
4s.
that anything
Oh,
over
okay.
50 was
So
considered high
that's how I
flow. With the
memorized it.
addition
So you
of
just
the
remember
actual
one of them.
flows for our
It's
high
like
flows,
the
they
10
don't use
would
that
go to
terminology
55,
anymore. They
and then it just
usually
goes
say
9,
if it meets your
And that's
inspiratory flow demands,
Yeah,
it's
it's
high
simple
flow. If it doesn't, it's low flow. But yes, it is more traditionally anything
That's
above
the
10 liters used to
aerosol
be high flow,
mask?
Kayleen.
And the simple mask is
Because
the
you could
ones
run
that
it on a
look
breather at 10
similar
liters
to
for some
they
people,
look
right?
like
Okay, then I think that's all in the oxygen devices, you guys, that you guys will have to know. These things were helpful, so I was showing you guys, just so you guys know they're out there, the little gray pieces. This is actually with a cannula.
That's just with the earpieces.
Yeah, so it's just a little cushion, you guys. So if you have people complaining about
Oh, 'cause
the
it gets
pain
sore?
on their ears, some facilities have these little cushion
Oh,
things
that's
that will
nice.
go around the nasal cannulas. Yeah.
I'm gonna have to rewatch this
Brandon,
video
you're only gonna have to
500
do-
times.
We're only gonna have to know one of these, right? Because it's the same thing. Okay, that's what I was.
It's the same
That's what I was explaining.
Yes.
Wait, what?
They
Oh, I have to
are
know
the
what.
same thing. They are both
Yeah.
heated
Are
high
you
flows.
able to tell us which one's gonna be out?
No.
Didn't know. That, what is that?
Oh, yes. What is this?
That's a humidifier, right? Or the baffler thing?
It's got a baffle. So what has a baffle that you know?
The nebulizer machines baffle because the bafflers are what break up the particles to make it small enough to aerosol.
Perfect. So this is a nebylizer, small volume nebulizer. These are both small volume nebulizers, but this one works differently. Well, how does this one work differently?
That one has the vibration, doesn't it?
I was
No,
trying to take
it's,
it apart.
it's a
So you know,
one-way,
like the
so
components.
you only breathe the medication, not one that goes back into the
Oh,
Good.
this
When
one
do you
goes
breathe
back
the
in the
medication
tube.
though?
when you breathe in.
Only on inhale. Good. So this is a breath actuated nebulizer. That's how you guys remember that. Okay. How do I know that they're able to actuate it?
You hear it.
You can hear it and the ball drops. The little green ball right here, you guys, will drop when it's on and when it's off. We can show you guys that. I'm gonna put my mouth on it. It's gonna be real gross.
No, don't do it.
Oh.
Oh,
Oh,
okay.
when you breathe in, it drops.
So
But it
that's
stops.
breath.
It starts on the
actuated
bottom, right?
nebulizer.
Or it, I think
And
it's
it only
up
has-
It was
on
because
the
it was
start.
turned to
one-way
continuous.
valve.
Okay.
Yeah, it only
So
goes
if they're
in.
not
water.
breathing it in, then it's not. It's just gonna sit there. And then
So
the
this
other
is
one, when they breathe in and breathe
breath
out, the medicine
actuated,
will go
and then
back
this is
into the
just
tubing.
Regular small volume
Regular-
nebulizer.
Okay.
Yep. Breath actuated. The other difference between these, you guys, is that with this one, I can actually squirt the meds in through the top, right?
Mm-hmm.
I don't have to take the nebulizer cup off. With this one, you actually have to take the top off to put the medicines in there. Okay.
So would we only use the breath actuated one on somebody that actually has the strength to breathe that deep?
Oh yeah. Oh
Right?
yeah. So what
So-
happens then if is there a way I can change that on the machine? Because if I can see that they're not actuating it, there's a way for me to just turn it to where it does it all the time.
Continuous. That's the.
And
The
that's
little
the top.
switch thing at the
Yep.
top.
So if I have, if they're on their mouthpiece, you guys, and you're watching them like you guys were me, and it doesn't drop, and you're going, I clearly can see her inhaling, but it's not dropping, I'm twisting that bad boy. We're just gonna give her a continuous treatment, and I'm gonna come back in with one of these probably later on, or I'm just gonna give her this one on the continuous all the time,
Okay.
until she either develops the strength to inhale herself, or we're just gonna leave her on the continuous.
Okay.
You're not,
So
you're not
regular.
expecting us the FiO2s of both of
No,
those, right?
these are not
Okay.
FiO2
All right,
driven
cool.
devices, you
All right,
guys.
perfect.
So small
But
volume.
what's the
nebulizers.
normal flow in this one to create the particle size that we want?
It has to be over 4, right?
It's more than that.
For the
Small volume nebulizer.
small one, 6 to 8, right?
Oh, 6 to
And
8.
then the
It has to
large
run
is
at this
8
one.
to 15.
And the what?
Large is 8 to 15.
Yes, that's a large, the volume
6
nebulizer
to
is what
8.
she's talking about. You
Where's-
guys, that's aerosol.
Where's those ones?
Those are not medication delivery, right? That's to give humidification. So that would be the ones that have these tops on, or the blue tops.
Unplugging them.
These ones have to have.
You're good.
What do these ones have to have, Mariah? The large volume nebulizers?
The large is 8 to 15.
I would just remember.
See, because it's saying 5 liters on the paper.
Would also be like large volume.
So remember, large volume aerosols are going to give you
think, right?
humidification.
That's the HME.
Small. Oh, this is actually a project. So what happened, you guys, is I just told you guys that nebulizers were an aerosol generating procedure,
Oh,
right?
okay. You already
Yes.
did this?
So what happened with COVID? When you have a nebulizer that has a one-way valve that exhales to the outside.
You're distributing it in the room.
So this is what they had, right?
O2.
So this is
But
what
I
they
think
ended
it's
up
just an extra
doing
piece. I thought she-
to try to combat
just makes
the
it, you know.
exhaled air from these nebulizers when they were doing COVID times. So I wanted just to show this so that you guys knew what was happening.
Is that an HME on the bottom?
It is not, it's just a bacterial filter.
Oh.
You can ask her,
Yep,
but I don't.
it was because this is where the outside air was exhaling from. Here's my limitation with this, you guys. Is your patient going to be able to initiate if this is the way it's set up?
That might be what she asked.
We don't know, right? But what I
That's
can
fine.
tell you is she's gonna pull air from here too.
Exactly.
Unlike in this one where she's only pulling air from one spot. So this will be harder for her to initiate if she can at all, right? So this is how they did it,
Yeah.
but
Sarah
just know
Waters.
that that's why
Yeah,
that you're limiting yourself with this or potentially causing more work for your patient, okay?
By adding that bottom piece.
By adding that, yeah, because she might not be able to initiate. Okay, so differences with these, you guys. Small volume can give medication. Large volume only gives humidification.
I think we're gonna
Okay.
use sterile water.
Okay.
This would have a bottle of water on it, right? So
Only humidification.
only humidification. You can do heat with them too, but that we're giving these for heat and humidity. We're not giving them for medication like the small volume ones, right? So large volume nebulizers, aka aerosols, humidification. Small volume nebulizers, aka nebs, they call them. That's going to be your medicine delivery devices. Okay?
And this was 8 to 15.
And these liters are 8 to 15. Yes. And these, when you guys set them up, do you recall how we check to see if we have high enough flow?
If it's bubbling.
It will bubble. It should bubble all the time. But we're going to turn the flow on, right? And it's got a long tubing. You guys are going to have it connected to an interface.
If it's condensated.
Good. If you can see the mist out the end of it, right? So I'm going to check to see if I have the mist out the end of the tubing when I have it hooked up. If I have the mist, I'm going to be like, okay, I can put it on my patient. And then just like with your non-rebreather, you guys, when you put it on your patient, when they breathe, you still want to see the mist. So if when they breathe, you don't see mist, you're going to increase your
the
flow.
Okay.
Yep. But these ones, large volume nebulizers, are not meant to give
Only for humidification.
flow that will overcome my patient's inspiratory flow demands. Right?
Just-
That's your heated high flow. These ones are literally just given just to give heat and or humidity.
Okay.
Okay. Nebulizers,
Medication.
medication only. Breath actuated, so they only get it on inhale. This one they're going to get on inhale and exhalation because it doesn't have a control. Okay. And then I was going over just the pieces, just so you guys know what they're called.
Mouthpiece.
Yep. Mouthpiece. I know it's so stupid, but if picture
No, I'll
this, you guys.
overthink it and
An
freak
RT
out.
says, "Hey, go get me a piece of neb corrugated tubing." You guys are gonna freak the fuck out and be like, "What the hell are they asking for?" And then you're gonna go back and you're just gonna get a whole nebulizer thing, right? Then when you take it back, the RT's gonna dig through it and grab just this piece.
That's the net
So
corrugated
that,
tube.
corrugated tubing for the neb. Okay, this can be anything because I can tell you guys corrugated tubing, and it could be.
Is it universal?
This
Would it be
one.
that
It
color?
is. It just could be this, you guys.
It's just an extension.
I'm just gonna bring them a whole machine. Take
Yeah,
it
it's
apart.
just the extension. But
They might
they're
come in
gonna
a
tell you-
box and they might be like, go get me some corrugated tubing. You're gonna have to know what they want. This is gonna be a large volume aerosol or large volume nebulizer stuff, right? This is your small volume nebulizer.
Oh, careful.
Yeah, we're good.
Break it.
TPs, good?
Medication cup? What's that? What is that actually called?
Yeah. Nebulizer cup lid,
Okay.
nebulizer lid, okay? You guys know that one.
Baffle.
The baffle, good. Nebulizer cup, nebulizer lid, baffle. Just so you guys know how they all get put together, right? This is not, you can't do it wrong, you guys. It literally only lets you put it together one way, okay? Regular oxygen tubing. Good deal. Questions about this one?
Nope.
Okay. What was my flows I told you guys?
6 to 8, right?
6 to 8. And why? Why do we do 6 to 8?
Because it needs to meet respiratory domain.
Needs to meet inspiratory flow.
No,
there's
it's a
enough
certain
flow with the
FiO2, right?
medication rule?
So the particle sizes will get small enough. We know that if we crush them against the baffle at 6 to 8 liters, the particle sizes will get to less than 5 microns, which means we can deposit them in the lower periphery of the airways.
Okay.
Eh.
So it needs to break down the.
It's to break down. Yep,
'Cause
the gas
so-
flow is helped to break down. Remember, it said if you increase your flow, you're going to get smaller particles. And I was telling you guys sometimes that's a good thing, sometimes it's bad, but most of the time it's just because you have a lazy therapist who wants to make their treatment go quicker.
So if we did it lower, they wouldn't break down in the right size to airways.
So if you're running it under 6 liters, they're not going to get deposition where you want it because the
Okay.
particle size is not going to be small enough. Yes.
And then
Okay.
if you go over, it doesn't have enough time to.
it's gonna
Settle.
dissolve
Blanks,
faster
right?
before
Right.
it
So
can,
what ends up happening?
it's
they
gonna
exhale
just,
it.
oh, they blow it.
Remember, we said if the particle size is less than 1 micron, they can just exhale it like we do our CO2. So if they're just exhaling it, they're not getting any medicine.
So once again, that is, it's 6 to.
6 to 8
8
for this one, and then
Because of the particles, we want them to be,
less.
disposed.
To maintain adequate particle size
What
for
and the,
deposition.
what was the
You just need to make it
particle
smaller.
size again?
Yep.
You need to
5,
make it smaller than 5.
Under 5 microns.
but
yeah.
not. But you said
1 to 5 is ideal.
Oh, okay.
Yep, 1 to 5 is ideal. Under 1, and you can exhale them out. 1
Okay.
to 5 is going to deposit in the lower periphery, and I think 5 to 10 would in the upper periphery. I think is what it said.
And then
anything above 10 is your face. Or
8 to
something.
15 for humidification, and the way to tell if it's on a high enough flow is if we see the vapor.
Yep, you want to see the
Mist
humidification
or-
coming out the end of the tube. Yep, even when your patient breathes.
Okay.
Okay, both large volume nebulizers generally only on people to give humidity and or heat. But with these two devices, you can manipulate the FiO2, right? But it's going to be your wide range like your oxymasks is, because they're all going to go down to almost room air, and then up to as high as 98%.
Okay.
I can't think of anything else, you guys.
Oh, you did ask something about a board on gauge, and
Oh, yes, I busted that
That's
out.
what
And it's
I
here.
was going to ask.
there were 2 on there, and one's okay.
That is an ass. That's an ass one. Here's our board on gauge, I think.
Okay,
Well, that's not our board on gauge either.
that's
Here's
the
our
pin
board on gauge.
system one, isn't
Yeah,
it?
you're just.
Yes,
doing
it is the pin system.
That's
You're
the
doing pin
yoke.
system and the board on gauge, right?
You got to know the difference between the
Regulators.
3 systems. So the aspis disc, and then know what happens with the board on gauge with downstream restriction. That's all I want you guys to know.
With a downstream restriction,
First of
flow
all-
is limited
Yes,
or reduced.
flow will be not accurate at what this says, right? Because what's going to happen is this is going to read the flow based on the pressure it feels in the tank. Okay? So then when you apply downstream resistance, there's not going to be a change here. The way you even know it's a board on gauge, though, you guys, is because you have flow and pressure on the same one.
Okay.
Okay?
Isn't this the yoke thing?
This is the yoke.
And that's a pin system.
This is the pin system.
and
Yep.
that goes on the portable tanks.
That goes on
and
your
that's
E-cylinder.
not gravity dependent. It will work no matter what direction you put it.
Yes.
Okay.
Oh, yeah. As long as it is put on correctly. Now,
Yep.
when you go to troubleshoot tanks, what are you wanting to make sure of when you put this on the tank?
Well,
When I crack it, should I hear leaking?
Yeah, it should be
Nope. I should not hear any leaking. That's all you really need to know about troubleshooting tanks, you guys, and regulators, is that if I crack it and I hear a leak, something is wrong.
so don't use that one. Move on. To
I need to
next.
troubleshoot the system and see, is it my washer? Could just be my washer. Maybe it's something super simple like that, and then fix your washer. But if it's not the washer, you guys are probably going to need to get a new tank, yes. The reality is you guys probably won't see this in play in the hospital at all. We don't use board on gauges anymore, right? Your tanks will have regulators on them already. So you guys won't have to worry about that. But you guys do need to know of the limitation until you guys get to 160, and I can tell you officially that it's not going to be on your board exam.
Okay.
Okay. I can't think of anything else. Anybody got your study guide? We can just-
With the flow meters, it's
Sit down.
besides it being upright, and then
oh yeah, how to read it.
so it needs to be upright, and then we need to read the ball in the middle, and we need to be eye level with the ball. Besides
Perfect.
that, is there
Yep.
anything
Thorpe
else?
tubes, right?
They're called Thorpe tubes. Yep, the top of a flow meter is called a Thorpe tube. So when you're looking at your Thorpe tube, when I look at the ball, what portion of the ball am I looking at?
The center.
See. Yep, that's all you guys need to know. I'm looking at the center
Humidifiers
of the
are
ball.
used with high flow low flow nasal cannulas
Okay, low flow above what? Flow.
4.
Is there-
above 4.
Yeah, because there is times I told you guys you don't have to use them, right? So if somebody is 3 liters and below, you don't necessarily have to have them on a humidifier,
Unless they ask for it
Unless they ask
and you
for it.
see signs of humidity
or you see
deficit.
signs of humidity.
Those are
Yes.
the only ones that need the humidifiers, though, right?
Yep. Also, one specific type of patient, because we bypass their upper airway.
Drake.
Trach patients should also have humidity always, unless they're refusing it from you. They should get it.
Okay.
And are these also called Thorpe tubes or no? Because they're just oxygen.
No, they're all called Thorpe tubes.
Oh, okay.
The Thorpe tube is the general term, you guys, just for the top portion of the flow meter. Thorpe tube used to be used interchangeably with the word flow meter. So you will still potentially run into, like Gina did it all the time, you guys, the instructor that used to teach this. She all the time called these Thorpe tubes.
But they're just, we call them
Flow meters, Thorpe tubes, yeah, Thorpe tube is an older term, flow meter is a newer term, yeah.
Okay.
Can you show me how this is used again?
Yep.
So that it's the only thing of like what's
Do you
in
see
here.
anything else we
So
didn't
we know
ask?
this is the sterile water here.
Did she
Yep,
explain the
so you're
regulator
gonna control everything
components?
from this,
No,
Like,
that's
is
a
that
great
the-
right,
question.
even your flow that you're
I'm
gonna
just
turn
wondering
on
if that's
here.
the
Oh my
this
God,
is
it's in my
this.
From
hand.
here,
I
because
hate
that's where
this
you're
stuff.
looking for the FiO2 analyzer. So you're gonna control everything
So
from this, so
I
once you
feel
get
like the
this turned
components
on,
is just the
you just need to know
that like pin system
how to
or
start
that
feeling.
yoke collar
You
that
do,
you're talking about.
you do, you're gonna turn this, but I'm
Because
gonna
that would
watch
be a
this,
component.
You said
right?
the flow
That's a
first,
safety
and then
systems,
it's
but the
flow down here,
regulator-
or it's different?
So the flow here
That's the
does
thing,
not
I don't know,
correspond to the
like,
flow that we're giving the
I'm
patient
not
at
sure.
all. The flow here
Therapeutic
is only
devices from
used
lab.
to pull in oxygen as well as room air here as an air entrainment device to create the FiO2 you want, right? So that's the biggest thing for you guys to understand here, because this is very hard concept. When you guys get into the field, you guys will start jumbling it in your head and it's really crazy. So just know that on a high flow device, the flow that is controlled from here on an Airvo does not control the flow to the actual patient, okay? That does change, you guys, because on this one, my FiO2 is controlled here, right? So the flow that I'm controlling here is what is going to the patient. So that's one big difference in the two machines.
So this will control the FiO2.
This will control
With
the
the
flow.
oxygen
This
Oxygen.
controls is the FiO2.
That's the oxygen. Okay.
Yep.
And he brought up the other one.
So the difference is right here, I'm setting this to a specific concentration, Kayleen, right? And I'm going, okay, what's coming out is 50%, right? The difference here is I'm going, see, I'm turning, but I'm looking here. And I'm turning this up only until this gets to whatever FiO2 I want.
Okay.
Okay, then I'm going, okay, the FiO2 is good,
Okay.
right?
So this still brings in the oxygen, but
Yes.
this controls the FiO2.
But this is in training room air to control the FiO2, exactly. As opposed to this, the air entrainment's happening up here, but I'm setting it before I need to worry about the air entrainment. Now, that being said, you guys should recognize that these processes that work exactly correct are very different in the how they get to the patient, right? So how they are the same brings up many more questions for me.
Is the temp is just through the bottom on that one?
Yes, so you control
Like
it
you
from
can
the
control
Fisher
it.
Paykel.
Okay.
So on this, you guys, you have options for invasive and non-invasive. They are predetermined already settings. Invasive is always going to be 37. I don't know what the non-invasive is. I'd have to actually
That'd
look
be
it up,
like
you guys,
checked
but
or
it's a
ventilated?
set. It's mask or not mask, right? Ventilated with an ET tube or ventilated with a mask is basically what you're doing. They're basically saying you could put this as humidification onto your BiPAP as well if you wanted to use this for that.
What about this?
Check water.
This one, you're not going to do anything like that. No, this is the heater itself, honey.
Oh,
Not
okay.
talking about the device.
Okay.
Yeah, it's because it's too hot.
So it's only two. There's only two settings on that one. Because I know this one you can change the heat into like 4 different settings.
3 settings. You have
Yeah.
31, 34, and 37. Yep, there's only 2 on this one.
Okay.
I just don't know if the non-invasive is 31 or 34. I'm sure it's one of those. I just don't know which one it is.
And then
you guys,
are
so
we
I don't
gonna
wanna lie
need to
you.
know how to change it into the kids? I remember in our
No.
lab we changed it. Okay.
No, we'll go over that later on if you guys do put it on the kids.
know how regulators function.
That's your knowing that when you crack it, it shouldn't hiss. That's literally all I wanted you guys to know there, is to know when something is wrong with the regulator.
Okay.
Okay.
Right? So if I was to explain to you, hey, give you a scenario and say, you just put the regulator on an E-tank, and when
Okay.
you crack the tank, you hear hissing from around the yoke adapter. What is your next step? Your options would be something like, go ahead and use it, it's fine, right?
Tighten the yoke.
tighten the yoke or the regulator, right? Take the regulator off and try another regulator. You should be able to pick the right option for that.
Okay.
Yeah. That's just a broad example.
And first, you would want us to
Vanessa,
try to
did
tighten
you-
it, right?
Try to tighten it first, right?
That was good? Okay. I just want you guys to know, because these are, we treat with them the same, right? It's just in the midst of putting it together, it's all completely different. It's just, you're still treating the same thing, right? We're still adjusting flow based on what?
FiO2.
But the
Oh,
We're adjusting
Flow
flow based off worker breathing.
Perfect, and you're adjusting the FiO2 based on
SpO2.
your saturations. Yep.
when you said those two options, now that had me confused. You first
Oh.
you first tighten the yoke collar, right? Because then you said to just get a whole new one. I was
You
like,
could do any of them, right? I just want
But
you guys
first
to
you want us to
recognize
tighten
it's
it, right?
wrong. Yes, I just would like you guys to not put it on the
If we hear a hissing, don't use it or troubleshoot the tank or replace the tank. Can I just put something like that?
Yeah, it would just be whatever answer gets you to the next thing. It's not a specific answer, you guys.
Oh, okay.
I was just using that as an example.
Are
I
we
don't
gonna
even
have
know that there's a
options,
question.
or is it gonna be all fill-in for this kind of stuff?
So the lab is all fill-in.
oh, it's all
Like every
I
single
think the
question?
lab is all fill-in.
Oh, Jesus.
So